The research is clear. Over decades of clinical studies, we've learned that when the body doesn't get the nutrients it needs before and after a procedure, healing slows down. Patients face higher risks of infection, muscle loss, and longer recovery times. But with the right nutrients delivered at the right time, we can meaningfully improve outcomes. Introducing Mend, Repair, and Recover Surgery, targeted medical nutrition protocol designed specifically to support wound and tissue healing. How Mend supports the healing cascade. Arginine plus citrulline increase nitric oxide and improve blood flow to the wound site. Protein and essential amino acids provide the building blocks for new tissue and support immune function. Glutamine drives cell proliferation, protects against oxidative stress, and fuels rapidly dividing cells. Zinc supports collagen formation and enhances white blood cell activity, reducing infection risk. Vitamin D helps control inflammation, induces antimicrobial peptides, and supports wound closure. Omega-3s support wound healing by actively resolving inflammation, improving blood flow and immune balance, and enhancing collagen and tissue remodeling. Evidence-based benefits. Collectively, these nutrients are backed by a significant body of published clinical research demonstrating reductions in postoperative complications, improved immune function, enhanced collagen deposition, and faster wound healing. As Dr. Paul Wishmeyer notes, the formula is truly unique and urgently needed. For your patients facing orthopedic, plastic, vascular, or general surgery, supporting the body's healing machinery is essential. Mend offers an evidence-aligned, easy-to-use protocol that strengthens your perioperative pathway and gives patients a measurable advantage in recovery.